One of the biggest changes I think we've seen, especially over the last decade, and especially the pandemic, is the shift towards remote care. And with diabetes, so much of what we do is self-management, very much on us or on our families. How have you managed that shift to so much being done now remotely, and so much of the care being done by the individual in the home? What are some of the benefits of that, and what are some of the challenges that you've seen as we're kind of we're still making this shift to more and more remote care?
Having that ability to watch your son or daughters or your loved one's blood sugars from a distance, even manage their diabetes remotely nowadays with some of the DIY systems, when you can actually control everything from a distance, that's a 22nd century type Jetsons, whatever you want to call it, ability. The challenge is going to be, though, in how it affects our human relationships with each other and our ability to let our children grow up and let us feel like we have some autonomy and some independence. I know that part of what we want to do is eliminate the burden of living with this condition on people, and these devices do lift the burden for a lot of people. At the same time, they remove many of the essential skills people need to maintain their diabetes management were they not to have these devices. And I see that all the time, and I'm sure other people we've talked to would tell you exactly the same thing, that they become de-skilled, as my good friend Steve Edelman will use that term quite a bit, de-skilling. And I see that in my practice every day.